Hello students, this is your instructor and I will do some practice questions for CPT coding for musculoskeletal system, the subject we discussed in our discussion for this week. So please follow me, my steps, and how to find the codes for various questions we'll be practicing. The first thing I want you to remember is make sure that you read the question with me, pause it, find your own answers, and then review it with me to see what mistakes you could have made, how to pay attention to the different points that we need to remember when we are coding for various systems. Every system in the CPT coding is so very much different from each other. We have to make sure we are confirming our guidelines in every section and trying to make small notes anywhere possible to be well read and well prepared for your CPC exam. So let's code the scenario. Patients having ongoing back pain and hip pain, the physician elects to perform a sacroiliac injection at an ambulatory surgery center. After sterile prep, the patient is placed prone and under fluoroscopic guidance. The needle is placed into the SI joint with a mixture of 20 milligrams of celestone and marcaine for pain relief. Code the procedures. Now remember how it says code the procedures. Whenever you read your question, you want to make sure you pay attention to what the question is asking you to do. So let's say if it's asking you to do procedures and you're looking for ICD-10 code, then you are wasting your time. And time is money when you're doing CPC exams. So kind of prepare yourself from now onwards how to look at the question and how to find the answers. When you're doing the question without any answer choices, it is totally different from compared to when you are answering a question with multiple choices given to you. And as you can see, you have two choices. You have a 20,000 codes and you have a 70,000 codes. You should already know as to what codes are 20,000 and what codes are 70,000, because then it will be a time-saving step for you to quickly choose your answers. Now, if you're coding for a musculoskeletal system and there's a 30,000 codes given here, you will not be choosing that automatically. So you don't even have to look for it, correct? So make sure you are preparing yourself, organizing yourself and your book according to how you prepare for this question. So the first thing I want to do is I read the question. What are they asking me to find? It's procedure, or S, meaning I could have two choices, I could have one choice. And you can see they're all 20,000, so definitely I have to make sure I look into all of them. So the first thing I need to know is what are my main terms, and of course, what did the doctor do? That's the most important thing I want you to remember when you're coding for CPT. You code for CPT, you ask a question, what did the doctor do? You code for ICD-10 diagnosis, you always ask yourself a question. What is the problem? Why is the patient here today? Okay, so that puts your mind into the right organization, because sometimes we're just so lost. We don't know which book we're looking into. We pick up the wrong book and we start looking for an ICD-10 code in a CPT manual, and I've seen that a lot. So I'm just mentioning that to make sure that you pay attention to that. So my main terms are, what did the doctor do? So what did the doctor do? Let's see, right? He gave an injection. Excuse me. Injection. So we will use that. In CPT coding, you can use either the procedure or sometimes the condition as well. It depends, right? So you will practice and you will learn accordingly. So my first term is going to be injection. My subterm is the location. Where was this injection given? And you have to come back to the scenario again and read the location. It says back and hip pain, but where was the injection given? It was given in the sacroiliac joint. Okay, that is something you have to know. So you have to make sure you understand the medical terminologies of the various bones, muscles, ligaments, tendons of the musculoskeletal system to be well prepared for this kind of scenario. We will find the code in the index, and then we will go to our tabular list to confirm whichever code is true and apply towards our understanding. So just keep following me. So I'm in the index section of my CPT manual. You can see it is all starting with eyes, and it has the word injection and eyelid given, so that's easy for me to find that the word is exactly on this page, and I can see the injection. Now that's my main term, so I'm looking for the subterm, and remember the subterm was the location. So I'm going to continue to read and follow the ABCD and try to find the SIJ location on the hip area. So where is it? Here it is. As you can see, if you can see it, let me see. Yes, you can. Yes, you can. I'm trying this different thing, so it could be a little confusing for me to. Here we go. Found it. So the SIJ, and the only code given with that is for orthography 27096, which is one of the choices I have. So I'm now going to go back to the tabular list, which is the beginning of the book, and try to find this code that I've located. Okay, so I'm in the beginning of the book in the surgery section. The subsection is the musculoskeletal system. You can see how the code ranges are already given to me. So in case if I have landed somewhere else, I always keep an eye on the top of the book and then follow the codes to the code that I am looking for, which is 27096. It's right here. And you can see how it gives you the exact keywords that we're looking for, right? So 27096 is injection, sacroiliac joint injection with image guidance, fluoroscopy, or CT, including arthrography. So what is that telling me? I did not do arthrography. I do not see arthrography in the procedure that I'm looking for. So that means the image guidance is included in this code only if you did arthrography. Okay, if it's not included, what am I supposed to do? I will find another code for this CT done for needle imaging. Okay. I also want you to make sure that you're reading all the details. Do you see how all the notes are given here? These are very specific codes that you need to keep an eye, especially in the exam, because in CPT exam, they will confuse you. They will always give you something that is different for them to judge you if you know how to read the guidelines. Okay, so we did all the steps, right? We had a question, we found our main term, subterm, our code, and we figured also that there's no radiology code that is included or part of the code that we were looking for. So we have to find another code, and we have two choices now, A and C. They both have 27096, except we have a different radiology code, which is what we will do to find the correct answer. Okay, so I can go to the index, find fluoroscopy. As you can see, I'm on it right now. Under that, I am looking for spine and paraspinous, because remember the SIJ is a bone. A sacroiliac joint injection is within the spine of the lumbar vertebrates, right below that, next to the hip joint. And the code says 77003, so now my next step is to go to the tabular list. Okay, I am on the tabular, the front section of the CPT, under the radiology section, and it says 77033. It says fluoroscopic guidance and localization of the needle, which is what we did, at the catheter tip for the spine, or the paraspinous diagnostic and therapeutic injection procedure, which is what we did. And in addition to code for the primary procedures, you can see it's an add-on code. It cannot be submitted by itself. It has to be a second order in the frequency of how you place the codes. The first code will always be the code that we found, 27906, and then the second code will always be the 77003. You want to make sure that you read the guidelines. The guidelines are also posted on the front or the page previous to that. And it gives you a lot of information that you have to keep an eye on and actually be prepared. Like, do you see how I kind of put notes, underline, and do something? You have to make sure you're following that. Okay, so let's get back to our question. We have a choice now, right? We have answer is A 27096-770326, which is the modifier. Remember, we do not forget the modifier, because modifier 26 is a professional component, because you are coding for the CPT procedure code. The procedure was done by the doctor. You always put a radiology code for the doctor, which is the modifier 26, giving him the part of the payment from the insurance company. Professional component modifier 26 is only for the physician services, not for the machines used in a certain surgery center. That is a separate pay, and that is 60% of the payment. So for just using that machine, doctor gets paid 40% with the modifier 26, and the technical component, which is the TC component, is given or paid to the person who owns the machine, if that makes sense. So make sure you keep the modifier 26 in mind and use it accordingly. Okay, so let's do another quick question. Okay, so if you can read the question: Andrea fell down the skating board, broke her acetabulum. Her physician performed a closed manipulation with skeletal traction. How would you code this procedure? Do you see how many codes we have here? And remember, most of them are choices, two choices which are the same, 27220, 27220. So we have to know either I choose one or both. With the modifiers given to you, you have to make sure you understand these modifiers really well. And you have a 27222 code just by itself. So how do I start? Where do I start? And that's a question you will be facing in CPC exam. So I did highlight the main terms, subterms for you. So what exactly did the doctor do? He did everything that you're looking at is called fixation. Okay, so we will look for the word fixation. I'm in the index of the CPT manual. You can see it says fixation device wrist. Easy for me to find. And remember, how do I know it's fixation? Because I keep practicing, and that is the only way to know these various terms. You can also look for traction, but it's not going to help you because there is nothing there. So you literally have to research what is this procedure and how do I find the main term for it in your content, in your musculoskeletal system content page, and just research online. Maybe that will help you as well. So we're looking at fixation, and remember it said acetabulum. What is acetabulum? You have to research that too, and you should already know that. So if you know that acetabulum is actually the joint, the hip joint, the round surface of the hip joint that attaches itself to the sacrum, that's what you're looking at. You see how it says hip and then the acetabular fracture, and you can see the code ranges are given here, 27226 to 27228. Now, if you notice 27220 and 27226, what's the difference between the two, and how will we choose that? So if you look at this, it says closed, treatment of acetabulum, hip socket fracture without manipulation, and then you have with manipulation, with or without skeletal traction. Okay, so if you look into, let's take a look at it. You have choices given here, right? You have 222 and you have 27227, 272. We don't even have a 26 choice given here, right? So the open treatment 27226 is not even a choice. We do have 20 and 22. Why are we choosing 27222? Because you can see 22 is the one that says with manipulation, with or without skeletal traction. Both of these things are given in my scenario, right? So, and that's why I'm choosing that, closed manipulation and skeletal traction. So my choice is 27222. I don't need a modifier. So if you jump onto, in the exam, you don't even have to go to the index. You jump onto the tabular list. Right now, as a student, I want you to go to the index. I want you to figure out the different names, because that's how you learn the vocabulary, and keep practicing everything what we did today. If you have any questions, do not hesitate to reach out. Thank you.